The first step to make a maxillary custom tray is we need to make the outlines of the borders. And first we use a blue pencil, and you start with your hammer notch area. And what you need to do is draw a line to the depth of the vestibule. So I don't know if you could see here. There you go. And what I'm doing is basically following the deepest portion of the depth of the vestibule. Just kind of going around, okay? Going around the buccal frenum, down to the labial vestibule, and again around the labial frenum, and down again to the buccal frenum, and down to the other side of the hamular notch. Okay, and this is important. From the hamular notch to the hamular notch, it should be a straight line. Okay, and I'll go into detail later on for the posterior palatocele area. Okay, so for now, I want you to draw a straight line, okay, as you can see here. Now what you need to do is, okay, here's how it looks. You could see the blue line all the way around, okay, and this is recording the depth of the vestibule. Second, you need to grab a red pencil and 2 to 3 millimeters above the blue line, and you start with the hamular notch and you go down 2 to 3 millimeters. Okay, this red line, what it is it's going to be your future end point of your custom tray, and of course I'll go over that. Okay, and I'm going around, I don't know if you could see here. Okay, as you can see here, 2 to 3 millimeters above the blue line here. Okay, when you come to the labial frenum, okay, you're basically making a V line. Okay. The labial frenum it's not active at all, so you don't need to make it pronounced. However, when you get to the buccal frenum, you do need to make it pretty opened up, basically. You go around just again 2 to 3 millimeters. Okay, and here it is, the red line, which is 2 to 3 millimeters above the blue line. Okay, and this outline is going to be where the extent of the custom tray. So from the hamular notch area, you do not need to go 2 to 3 millimeters before that. For the hamular notch, it's actually the same line as the blue line. Okay, so you just go straight. Okay, so this is your first step, and this will be one of your projects. Okay, to draw these two lines. Okay, and again, this blue line indicates the depth of the vestibule, the deepest portion. The red line is where the custom tray is going to end. And you can see there's going to be space, obviously, right? And we'll go into detail why we need that space later on. The next step is to make a custom tray. And I want to show you, you guys are going to get this material. It's called a Triad True Tray, which is the company. And what it is a custom tray material. And it cures by the light. Okay, so if you open that up, you'll get this triad material. Okay. There you go. Okay. Okay, so we'll put that on the side. The next step is to make a wax spacer. Okay. A wax spacer basically is creating a space for the impression material. Of course, we're making this custom tray to make another impression. Okay, and what I just did is I just turned on my Bunsen burner here. Okay. I want to burn the camera. Okay, so the Bunsen burner, you guys will use the gas that is in front of you right now. So let me see if I could raise this up a little bit. Raise it up a little bit. Great. Okay, good. So here's the cast. So again, back to the wax spacer. The wax spacer, basically what it is that's going to be occupied by the impression material. Okay? And most of the time in clinic, you'll be making the impression with polyvinyl siloxane. And we'll go over that impression material later on as we go. But polyvinyl siloxane, the studies show that you need at least 2 to 3 millimeters of impression material to be accurate, and it won't distort. And so in order to create that, you need to put this wax spacer in. Okay? And what you need to do is heat the wax up first, just enough so you could work around it. You can see as you heat it up, you could be able to mold it and just play with the wax here. So just keep doing that, okay, so until you get that consistency where you can mold. And once you get that consistency, you could start putting it on the cast. And as you gently put it on, I don't want you to forcefully, otherwise you won't get that uniform thickness. So just kind of gently put around. Okay, I'm just using light finger pressure, so just kind of molding it into it. And after that, what you need is a scalpel here. Okay, so you need a sharp scalpel here. And all of you guys have this in your kit. And you start trimming your wax according to the red line, not the blue line, but the red line. The blue line is actually only there for you to guide you for your red line. Okay? So the blue line really doesn't come into play when you start making the custom tray. It's just a reference point for you to make the red line. So you need to cut back. Let's come back here. Okay, so you start cutting back where the red line is. Okay. It's not rocket science. It's pretty straightforward, practical. Okay, and as you can see, I missed this red line right up here. Okay. And make sure if you can see. Okay. So don't worry, if you do miss it, all you need to do is add. Okay, you can see here, all I'm doing is just adding the red wax where I missed. Okay, so here it is with the wax spacer in. Okay, now the next step is making stops. Okay, and the purpose of the stop is the tray. Without the stop, what happens is you don't know how far the tray should go in the patient's mouth. So the stops gives you a reference, so that way it touches the tissue, and everywhere else it'll be like a blank space for the impression material. And then you need 4 stops, and it should be placed far enough of each other. Like maybe one here, one in the canine area, second molar area, and the canine. You need 4 stops. And what you want to do is make it big enough, like a rectangle, so that way it's big enough and doesn't rock. I've seen cases where it was just too small, or it was just, you don't want it too big, otherwise it'll just create unnecessary sore spot where you have to grind it later on. Okay, so something like this. Okay, you can see there's a rectangle here, okay, and you need one on the other side. Okay, there you go. And then let's put 2 on the K9. Okay, so there's 4 stops here. There's 1, 2, 3, and 4. Okay, so the next step is you need to put, back then we used to put aluminum foil. That's how I was taught. But it's really not fun trying to get that off. So companies came up with something called, instead of using tin foil, it's a tin foil substitute, which is an Alcoat company. And here it is. It's this big bottle. And I actually got this off of you guys' your wet lab. Okay, so it's an Alcoat. It's a tin foil substitute. What you need to do is get a brush and put the solution in a cup. And what you need to do, I didn't find a brush, so I just used a Q-tip here. And what you need to do is put it on top of the wax. And the purpose of that is so that way later on when you adapt the custom tray, it won't stick to the wax. Okay, so you put that separator in the wax. Okay. Okay, all the way around. Okay, and remember this triad that I showed you? Okay, now it's time to take it out of the bag. And what you need to do is start putting on top of it here. Okay, before you do that, make sure you take a piece out at the edge. And what you need to do is put it in the stops here. Okay, so take a little piece out. Okay, and put it into the stop area. Okay, 1, 2, 3, and 4. Okay, so here it is, 1, 2, 3, and 4. And then what you need to do is utilize the rest and gently place it in. Okay, here we go, here. Just gently. You don't want to press it too hard, just like when you were doing it with wax. Just gentle pressure all the way around. Okay. And then again, use your scalpel, a very sharp one, and go around. And it should be where the red line was again. Okay, you can see that all the way around. Make sure it follows the red line. Okay, you can see here where it follows the actual red line here, all the way around. Okay. And it comes from handler notch to the handler notch straight on. Now what you need to do is the rest in here, you don't throw this away. What you need to do is start making a handle. Okay, so you start molding it like a tomb shape, I guess. Okay. If you have big hands, then you have to make it bigger. If you have small hands, you can make it smaller. So basically just like a tomb shape here where you could grab onto it. Okay? Because this tray, remember, is going inside the patient's mouth and we're going to boulder mold. So it should be easy for you to grab onto the tray. Okay? And what you need to do is very important, guys, that when you place the tray, make sure it's not placed like this. See how it comes out obliquely? You don't want to do that. What you want to do is make it come down straight down, like this, straight down. Okay, this is a little too big. I just wanted to exaggerate it like that. And the reason being is, remember, there's a lip, an upper lip here. So when you boulder mold, you want the upper lip to be in a relaxed phase. If your handle is out like that, your upper lip gets caught in here. So it's very difficult, or it just when you border mold, it'll be, your extension won't be as accurate. So make sure the lip is in a relaxed position. In order to do that, you need to have a handle that's not interfering with the patient's lip. Okay, so I'll just make it straight like that. Okay. Okay, just enough so you could grab onto it. Okay. Doesn't need to be fancy or anything, just as long as it does its job. So something like that. Okay. All right, and that's it. So once this is done, it needs to go in the curing unit. I don't have it here, but I'll show you later on. The curing unit, what it does, it'll cure this triad material fully. So you cure it a good 4 minutes with it. Okay. So once you cure that, what you need to do is take out the wax inside out. Okay? As you can see here, I pre-drew the lines here. The blue line, of course, just like the maxillary cast, it indicates the depth of the vestibule, and the red line. So it's the same technique as the upper. The only difference is if you look at the retromylohyoid area, you can see there it goes medial to the blue line here. Okay, so, and just want to make sure you guys could see here. And you could see how it's medially placed here. And this area is very critical area, or the retromylohyoid area here. And make sure it's 2 to 3 millimeters short of the blue line here. Okay, and you want to make sure you have the wax spacer in, and I made it so that way here, okay, with the occlusal stops. And the same way as the maxilla, used the triad custom tray material. And you want to cut the tray where the red line is, just like the upper cast that we did. Okay. And by the way, the tissue stops, make sure you put triad on the tissue stops. I didn't show you guys that, but I think you guys got that with the upper cast. So make sure you put a little bit of triad material where the tissue stop is. Okay, here you go. So you could see the tray extent is where the red line is. What I see a lot in clinic, it's very overextended. You don't want the tray to go down where the blue line is. Okay, so that's very important to draw the blue and red line. So it gives you reference where to put the tray and where the tray ends. And of course, you have to fine tune it in the patient's mouth. Okay, once you got the base done, you don't throw away the remaining triad. You use this as a handle. Okay, and I'll show you how I make the handle. How you want to make the handle is you want to make it very like a rectangle here. And what I do is I put it on the occlusal surfaces. Just like an occlusal rim. So it just follows where the one half of the retromolar pad is, the height. Okay. So it's a reference where your occlusal rim should be. And the reason why I like this handle is, instead of this one handle that's picking up like the maxilla is, when you ask the patient to border mold and lift their tongue side to side, this represents the future where the teeth should be. So when they border mold and lift their tongue sideways, you're not shortening the lingual aspect here. So this handle acts like a teeth, the future teeth, and the patient motor modes according to it. So when the tongue goes to the left, it'll go over the handle, and it represents where the teeth is. And also it gives you an area where you could grab onto in 3 different ways. So it's very a good way to make a handle like this. Okay. So I don't have the curing unit in front of me, but after this, what you want to do is the same thing as the upper cast. You want to start curing it for 4 minutes, and then after you cure it for 4 minutes, you take it out of the cast and cure it for 2 minutes. And what I do is I always go back to the cast and cure it for another 2 minutes. Otherwise, what happens is the triad shrinks a lot, and there's a possibility it won't go back to the cast. So make sure you always go back to the cast and finally cure it. Okay. So here's a maxilla, and I put it in the curing unit, and once it's cured, you can see it's very hard now. Okay. And this is how it looks. And you can see the tissue stops that I placed on 4 of them. Okay. And after that, what you need to do is peel this wax out for the impression material in it. Okay. And also what you need to do is, you can see how rough it is at the edges. There you go. Okay. So you have to trim all this to make it very smooth with your acrylic burr. Okay. I won't demonstrate that here in this video, but that's your next step, is to make sure the edges are properly trimmed. Okay. All right, so these are the custom trays, and once you fabricate this, you'll need to get this checked off by a faculty before the patient comes. In your case, you'll need to get the grade sheet, and they'll grade you based on how you do your custom tray. Okay.